So my name is Richard. I'm an education advisor with HealthCert. So I've been working with HealthCert now for 8 years and in the medical industry for 25. So it's really given me a good understanding of the needs of doctors and their professional development. We become an excellent conduit for the doctors through their course and even when they complete their course because often they might have an interesting case. They're not sure about how best to manage those. So we often receive inquiries like that. But then it may be making sure that they get their CPD points or certificates. We're certainly happy to field those questions and really be an assistant to their pathway of completing their education, getting their certification. It's nice for them to have that up on the wall and really show what they've been able to achieve and show their patients what they've been working hard to accomplish. I guess the challenge with the new CPD home is that there's still a little bit of information to be communicated there, but the key changes will be the requirements that the doctors will have to achieve. Rather than it being over a 3-year period as it has up to now, they'll have an annual requirement. So essentially that will be 50 hours of education that they're going to need to do. They will need to be in 3 specific areas. One important one that perhaps they've not considered as much in the past is going to be outcome measurements, so really seeing how they're applying the learning to the practice. But the nice thing is that the HealthCert team are really working to make sure that in a simple way they'll be able to join our certificate courses and be able to fulfil those requirements annually. So we'll take care of the nuts and bolts, so to speak. We'll just make it easy for them to fulfil those requirements. Perhaps the simplest way to get in touch with us and to really think about first their learning goals, and then perhaps to even think about when they could set aside 15 minutes just to schedule a call with us. That'll give them some time where they've perhaps considered what are their learning goals. We might explore that a bit more with them, what they want to achieve, what their long-term or short-term goals are. So we'll look at how we can align their learning goals with the HealthCert pathways and achieve those. We've had some wonderful things over the years. I guess a simple thing is they've done their first skin cancer medicine course, being able to identify a melanoma on a patient. It makes the doctor so satisfied to think that he's now applied his skills, been able to identify that on a patient, been able to treat it effectively, and so that potentially is a life saved or certainly prolonged through the training and the application of that. But then we look at more long-term effects. We've seen doctors really transform their practice, gone from the challenges the GP day-to-day practice face to really being able to see a development of a subspecialised skin cancer doctor, and just how rewarding the life that it gives back to them and how that really renews their interest in medicine and just gives them a satisfied way to practice. So that's been wonderful to see.